We're first going to talk about low back pain. Now, I don't want to mislead you in that chiropractic is only good for low back pain, because that's not the case. But again, we're time limited today, and that's what we're going to specifically be going through in this PowerPoint presentation. We're going to talk about what chiropractic care actually is, what to expect when you come into a visit, and then we're going to talk about how chiropractic and physicians work very well together. So anyway, we're talking about how you guys are dealing with a lot of musculoskeletal issues where your options are prescribe them an NSAID, prescribe them a narcotic, send them for surgery, send them to a specialist. As chiropractors, we have other tools to help those patients. We can help their quality of care, quality of life, and that is going to obviously help you, because if you're seeing less of those people, you have more time. You know, you're going to be busy as a family physician, so you're going to have more time for other concerns. But what we do in terms of an adjustment, which is helping the spine be aligned properly, so you have the spine, vertebral column, the nervous system in the center. When things are off balance, when you have a shifted hip, when you can't turn your neck all of the way, all of those things are going to be what we're restoring. We're restoring function to the spine for the adjustment. But that's one part of it. That's a very, very important part of it, don't get me wrong. But other things that chiropractors do is the lifestyle modifications. So what is this person eating? What exercise, if any, are they doing? What's their work life like? How is their desk set up? You know, all of these things relate to your health, right? We're a whole body approach profession. We're looking at even mental stressors. That's a question that I ask because, as you know, I'm sure that you can think about when you're stressed or you're upset. Body doesn't feel as good. There's other things going on, okay? So I'm going to talk now about what you would expect if you were to walk into a chiropractor's office, or what you would expect your patient to receive. So in my office, you are going to get your forms prior to even coming into the office. These forms are long, okay? They're not just what's your name and what's your address. And, you know, we're talking about the 3 areas of health: physical, mental, chemical. So are you taking any medications? You know, have you had any surgeries? What's the stress going on in your life? What's your job like? Are you sitting all day, or are you lifting heavy things and twisting? All of these things are going to play a role. So that's something that we look into. We look into family history. We look into past injury. Did you get in a car accident when you were 10? I still want to know that. You still could be creating something and cueing into something. Once we've gone through that with the patient, so they come in with that information, we talk about that, then we go through an exam. So a normal exam for me would be looking at their posture, how they hold their body, looking how they move their body, doing some range of motion tests, doing some orthopedic tests, neurological tests, reflexes, upper extremity strength, all that type of stuff. And then going through palpation. Palpation is very important for us as chiropractors because that's how we feel the spine, that's how we feel the movement, that's our skills. That's what we're best able to do, is figure out where that spine is not moving properly. And it's the same as any skill. You know, it might seem weird that I can figure out exactly where the TVP is and how it's, you know, rotated to the left or to the right, but you know, that's what I went to school for all of those years, to be able to figure that out. We're going to go through a diagnosis. I'm going to explain that to the patient, explain all of the risks, go through the informed consent that we talked about, and then talk about the education. So do you need to really start doing some core exercises? We really need to strengthen your transverse abdominis and get things more stable in there. Is that what we need to do? Then we're going to talk about that. I'm going to show you how to do that and make sure you're doing that. Do you need to change your nutrition? Do you need to change your mental state? Are you in a really, really stressful life? Can you do something to help that? All of those things together is going to create that healthy lifestyle. And I also want to know the patient's goals. What do they want from this? Do you want to be able to pick up your kids? Do you want to be able to be a high-level baseball player? What are you looking for? Do you want to have more years in the job that you love? That type of stuff. We're going to talk about collaborative care and how physicians and chiropractors work very well together. So primary care through musculoskeletal injuries and conditions is really being improved for the better use of evidence, and we're really working hard for this evidence. So we have chiropractors in physicians' offices in Toronto and Hamilton and Thunder Bay, and we are seeing that these patients are having a lot more effective care. They're happier with their care. They are using these conservative methods, and they're getting positive results. The physicians are happy. You know, they aren't having as many visits You know, you don't have the follow-up, my back still hurts, what else can you give me? And that's opening up your time for other things that you're better able to address. It's all about communication. And you know, I'm sure that you all are aware of this in your personal lives. I mean, how many people have gotten a text that says something that you take the completely opposite way than it was intended? Same thing goes with working together. When we work together and we're able to communicate things, you know, a patient might tell you, oh, my chiropractor said this, but did they? You know, unless you talk to that chiropractor, did they really say that? That's where, you know, the communication is really going to move patient care forward and hopefully help our healthcare system in general. You know, $1.2 billion on low back pain. Why not try to reduce that a little bit and work better together? Right. It's not gonna, our healthcare system's not gonna last the way it is. We're spending too much, so we need to come up with ways to, you know, encourage the patient to look after themselves.